Myself, Dr. S.K. Sharma. I am Head of Department of Radiation Oncology at Rajiv Gandhi Cancer Institute and also the Chief of Breast and Thoracic and Pediatric Malignancies. In my department, there are 3 units. One unit of head and neck is headed by Dr. Sherawat. The another unit is headed by me for the breast, thoracic and pediatric malignancies. And the third unit is headed by Dr. Sarupa, and she is looking for the gynecological malignancy. Apart from that, we have the team of each unit where we have 7 to 8 doctors in each unit, 24 doctors in total. We have the DNB students where we train to the students also, which is equivalent to the MD at other centers. We have clinical assistant, junior consultants and the senior residents. Coming to the equipment, the Department of Radiotherapy at RGCI have 5 linear accelerators along with the planning machines in the form of simulator and CT simulator and the brachytherapy machine. We are treating around 200 patients per day at Rajiv Gandhi Cancer Institute. Okay. Patient comes to OPD. In the OPD, the patient was examined. Relevant investigations have been done to the further investigation are done to the patient. After relevant investigations, patients either subjected to simulator, oblique CT simulator, where we generate the CT scan images. Those CT scan images are then further contoured and given for the planning. The planning is done in the form of either IMRT, IGRT or SBRT. And the treatment is executed onto the linear accelerator with these equipment in the machine called as true beam or linear accelerator. And when the patient has to come to for the treatment on OPD basis, there is no need for admission unless until the patient is morbid. And the patient comes in OPD, it takes around 5 to 10 minutes as a procedure for the treatment. And the patient is evaluated every week in the OPD with the doctors. If the treatment is short of to a tune of 3 to 5 days, the treatment can be completed in just 3 to 5 days. Otherwise, the radical treatment might go up from 5 days up to the 35 days. The SBRT treatment technique today is comprised of the treatment of just 3 to 5 days, which is equivalent to the surgery nowadays, where the patient is also undergo surgery and 5 to 7 days patient goes back home. It's a common question asked by the patient, what is IMRT, IGRT, SBRT, stereotactic radiotherapy? This is just a form of treatment at particular site. For example, if you have the very small tumor into the brain and you want to treat it, it can be treated with 3 days of SBRT treatment. The full form of IMRT is intensity modulated radiotherapy. IGRT is image guided radiotherapy. We take a CT scan oblique X-ray before treating a patient, that is called as IGRT. It decreases the setup error. And IMRT is intensity modulated radiotherapy. Wherever we want to focus the treatment or we want to focus the dose, we can focus the dose and we want to protect the other area. I'll take an example of head and neck region where the patient with IMRT, you can save the parotid gland so that the patient will have no dryness for rest of the life. For example, if I treat the patient for the breast patients, then you have to protect the heart and lung for rest of the life. So these are the protection with IMRT. Then if you go back to the urinary area or gynecological area where you have to protect the rectum and the urinary bladder and treat that gynecological malignancy. So IMRT, IGRT is used for these sites. So coming to the myths which is there in the society, the myths will be that is cancer curable? Yes, cancer is curable if detected early. This message in stage 1 and 2, the survival is to a tune of around 100%, 95 to 100% for so many malignancies for 5 to 10 years up to 15 years. So cancer is curable if detected early. Now another second myth in radiation department, people ask what are the side effects to the body or rest of the body if I am going to undergo this radiotherapy. The simple answer is this is a local form of treatment as like surgery. It will have only local side effects. I am taking couple of examples. For example, I am taking a brain tumor patient. There will not be have any side effect onto the eyes or to the mouth or to the lips. It will have only loss of hairs. That too reversible. If I take an example of having a malignancy onto the cancer cheek or to the head and neck area, there we protect with radiotherapy, IMRT, IGRT facility technique, the parotid gland, the eyes, the lips, the nose, and focus that area with that area only where it is to be given radiotherapy. So it is a focused treatment today, and it will have only local side effects. Another example I will take. For example, I am treating a breast patient in female, either I am treating the conservative breast or modified radical mastectomy patient. Again, we have to protect the heart and the lung, and it will be a local form of side effects in the form of little redness, oblique blackness, which is again temporary. And the third myth is multiple. Okay, cancer.
Answer, I think it's.
Okay. The third myth in the society is that whether radiotherapy alone can treat the patient, surgery alone can treat the patient, or chemotherapy alone can treat the patient. No, in today's scenario, all the three modalities at one point or the other are required for the patient.